This is a topic, the title which is given to me, and I'll be discussing my past experiences, and also I will share with you how the experiences have taught me how to better use the technologies. I have nothing to disclose in this lecture. So these are the broad topics I'll be discussing today. I started using some of these devices when I was a school kid. And that was when my father was diagnosed with diabetes and its complications. And this is clinic sticks, still vivid in my memory. And before that, it was the Benric solution. And this was the glucose meter I procured, and that too for my mother long ago. Both these are historically now very, very important. So this is the Ames reflectance glucose meter, and this is the clinic sticks. Both of them very, very important. And Ames, both these from Ames, and Ames is now Bayer, and the Bayer, the glucose monitoring division has been acquired by Condor, which is now owned by Panasonic. So that is a long history of glucose monitoring. Let me start sharing with you a real life story. And this is when I started practicing. This was in late 1990s, and I had very good practice in diabetes. And this was a famous guy, a poet, who visited me in my clinic at home, where I practiced along with my nurse. And he approached us with uncontrolled diabetes. There was only one report available with him, no other laboratory reports, only a glucose value of 425 and a foot ulcer. And he is getting treated by a surgeon and also a family physician. We spent more than an hour. We spent more than 1 hour discussing with him what is diabetes, what are the complications of diabetes, what is the necessity for controlling the glucose, for evaluating the cholesterol, why you need to do the lab investigations to find out where you stand. But he was not even aware of a normal glucose value. Not at all aware of anything, despite 10 years history of diabetes. And he went back, and when I contacted him 3 days later, because there was no response from him, we were actually very sad. He was agitated. And he was telling us that when he discussed with his family, friends, and other close doctors, they told that these investigations are absolutely unnecessary. And the glucose meter, the device that we have advised him to procure, that is not at all required for the management of diabetes. And this is how the sad story goes. Even though I forget about this, I later on came to know that his foot was amputated and he died of diabetes-related multiple complications. Very, very fortunate. Why is it this story is important? This story is important because this is still happening. This is still happening all over our country. Glucose monitoring has advanced a lot from the earlier day devices, when, of course, they were very good even in the beginning, but some of them were inaccurate. It was extremely difficult to convince the physicians and the patients. And we used to have a calculation to convert to the plasma value, and a large drop of blood was required. And in between, we used to even lose waste strips. So over the years, the glucose meters have become much more reliable and accurate. And there is absolutely no wastage of strips. And if you go by the new ISO 151972013 recommendations, you can see the criterion A and criterion B. So this is to make sure that if you're using the newer glucose meters and strips, remember, all the glucose meters, all the strips are not the same. They are not the same. In India, we have more than a dozen popular devices, but go by the branded glucose meters. And these are the ones where almost 100% of these numbers will be there in zone A itself, in the Clark-Yarragal zone. And some of these meters, they're even capable of a second chance sample if the first sample is not sufficient or insufficient. And almost all of these are capable of generating a digital diary, replacing the conventional paper diaries and that too with color coding. Capable of remote monitoring, unlimited possibilities with My Sugar, the most commonly used mHealth mobile application for diabetes across the world. More than 3 million patients are currently using it. And I say it again, the possibilities are incredible. And this connects via Bluetooth to some of these meters such as AccuCheck Instant. So we were also over the years trying to generate more data, evidence-based data on glucose monitoring and telemedicine. And this is to convince the patients. And this is ADA in 2022, when the ADA is recommending that the providers should be aware of the differences in the accuracy. So now the ADA is recommending that we should be recommending to our patients only those glucose meters with a proven efficiency and accuracy. Let me now move on to the insulin pump therapy. Another major area, probably my strongest romance is with insulin pumps among all the available technologies in diabetes. And this is how it all started. My first meeting with her happened when I was at Mayo Clinic way back in 2003, when I was undergoing my endocrinology training, when I got first exposed to the external insulin pumps. Back in India in 2004, we initiated insulin pump therapy in our patients. Only to remember the year 2006, this was the year when real-time glucose monitoring was available, was started in our country. It is not in 2019 or 2020. From 2006 onwards, the insulin pumps were capable of generating the interstitial glucose numbers on the pump screen, displaying on the pump screen. And these were the beginning of SAP or sensor augmented pump therapy. From the beginning onwards, multiple challenges were existing for use of insulin pumps, for the successful use of insulin pumps. It was very hard to convince, especially the doctors, the senior experts in endo, in diabetes, and in allied specialties such as nephrology, cardiology, neurology, and so on. Insulin pumps are definitely superior, far, far superior as an advanced delivery gadget when compared to syringes, when compared to insulin pumps, when compared to insulin pens, I meant. And it was difficult, very, very difficult to convince the peer group. And hence we started publishing the data. And this is the first insulin pump guidelines we published. And these are from all over India. You have Dr. A.K. Das sir, who is also supported, Dr. Mohan, Dr. Ramachandran sir, Dr. Shashank ji. So all of them supported in the publication of this guideline. This was actually a necessity. It was a legal requirement for all the doctors and even the patients to appreciate what are the indications, what are the contraindications to the use of insulin pump therapy. Because it is very essential that you had to go by the available evidence from all over the world and from India. So this is on the dramatic response to intractable, painful peripheral neuropathy within weeks, within 10 to 14 days of initiating a continuous subcutaneous insulin infusion. Yes, insulin pump therapy is well known to bring down the pain of peripheral neuropathy, and almost all these symptoms will subside. And the same is true with erectile dysfunction. Reduction of HbA1c following 6 months of insulin pump therapy, and this is the data that we have generated in type 2 diabetes, again published in Diabetes Technology and Therapeutics. If insulin pump is successful, almost all the patients are going to have a feedback, and this is on robust improvements in the quality of life. What is the next big thing which is happening in diabetes in India? The long-awaited 780G is already available. We have started in 3 of our patients 3 days ago. And this is the most advanced FDA regulated device for automated insulin delivery. And this is the advanced hybrid closed-loop system, which will be discussed in detail by the subsequent speaker, Dr. Debasis. It automatically adjusts the delivery of basal insulin once in every 5 minutes, and that is in response to the continuous glucose sensor. So when the glucose is trending high, it will increase the dose of insulin. When the glucose is trending low, it will either lower or it can even automatically stop the delivery of insulin. And this is all thanks to, number one, advanced sensors, and number two, advanced algorithms. So algorithms are the most important component contributing to all these innovations. And in the rare instance of the patient or the caretaker forgetting to bolus, the device is capable of even delivering a bolus. And this is all determined by the algorithm. So when you compare with the earlier devices, I would say that this device is capable of reaching a time in target of even up to 79%, very close to 80% if you are manipulating with the active insulin time as well. So what are the factors determining the success of a technology such as insulin pump therapy in our country? To be successful, it should be much more user-friendly. It should be easy for the patient to troubleshoot. It should be recognized by the insurance companies and by the governments as a gadget, as an advanced delivery system, which can bring down the cost of treating the avoidable complications of diabetes. When does insulin pump therapy fail? That is also very common. Insulin pump therapy fails when the candidate selection is wrong. So this is on the experiences with using telemedicine in diabetes when we started way back in 1997. And we were successful in generating a lot of publications related to the use of telemedicine along with a structured self-monitoring of blood glucose, in reducing the A1C, in eliminating hypoglycemia, and in reaching the targets, in reaching customized targets in specific populations. We are still active during these COVID times. And during the last 2 years, ever since the COVID started, we have implemented the virtual COVID IP care, remotely monitoring the patients. We are providing this support only to our patients who are diagnosed of COVID. And we are even administering corticosteroids whenever necessary at their own houses. And we were able to publish the data on reaching and sustaining more than 95% time in target in almost all these patients who are on remote monitoring with either connected glucose meters or with connected continuous glucose monitoring devices. Yes, the CGM devices are also growing. They are also advancing. We started in the year 2004 in India with the first ever CGMS Gold. And the CGMS also has transformed, has gone through the same history, similar to the glucose meters. The earlier ones were less accurate. The earlier ones were very difficult to use. But now they are much more accurate. The cost has come down and it is user-friendly. It is user-friendly. And the Guardian Connect, the Libre, they are all extremely popular in our country. Guardian Connect is the only real-time glucose, continuous glucose monitoring device available in our country. And Libre is the intermittently scanned device. Both of them can generate the data on TIR. So this is my concluding slide. More than 90% of the physicians are currently recommending the use of newer technologies only after waiting for more than a decade. But you know, technologies, if need to be useful, they need to be used and recommended immediately, soon after it is launched in the world. But remember, nowadays, if we doctors are not recommending the technologies, the patients will themselves search for their available and user-friendly technologies. They will not wait for the doctors anymore. And that is a take-home message from me. Thank you very much, NUCD and the group, for inviting me and giving me this opportunity.